So what is Uber Health? So Uber Health was born out of a clear problem in the healthcare market. Healthcare costs are skyrocketing, and a lot of these costs happen with populations that are older or suffer from chronic conditions. And the people that suffer from chronic conditions, oftentimes they require to visit the doctor more frequently to treat those conditions than an average patient or an average person. However, the challenge, lack of transportation, truly limits access to care. So we found that in all of these studies that we've done, that about 80% of older adults have at least one chronic condition, with 68% having at least two chronic conditions that require them to frequently visit a healthcare provider. And fortunately, 72% of older adults found that their priority was to get to medical transportation, but they couldn't find available transportation around them, either because there was no public transportation that could take them to their medical appointments, or because they weren't able to drive, or because they have a physical disability and therefore they are not able to driver's license. So we found that really getting to care was the first step that we needed to solve. Um, and we found that actually by not making their medical appointments, they're costing the healthcare infrastructure a lot of money. For example, in the United States, we found that 30% of people miss their medical appointments. So no shows, it's called no shows. And this costs about $150 billion a year. Because if you think about, if you miss your medical appointment, then your doctor now could have seen another patient that would require help or assistance and is unable to see that other patient and is unable to see you. So it's really waste. It's called medical waste. And this is something we were trying to solve. So Uber Health came then from that need to develop a platform that would allow healthcare providers in a secure, HIPAA compliant, HIPAA stands for the Privacy Act, to make sure that all the medical data is encrypted and anonymized. And so we built a platform that allowed institutions to schedule rides on behalf of patients. So you don't have to, as a patient, let's say you're an older citizen. Normally, older citizens, they tend to be less smartphone savvy, and many of them don't even have the Uber app on their phone.